Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of this valuable, you're of course welcome to take it and use it as you see fit. Just please make sure you do so safely. So this is an exercise for anyone with some sort of shoulder issue. It might be a rotator cuff related issue, maybe a tendinopathy or a tear or something like that. Or it might be someone who has some sort of shoulder strains, like a deltoid strain or particularly a medial deltoid strain. For anyone who really struggles with doing this motion, bringing the arm out to the side, which physiotherapists will call shoulder abduction, ABduction. And this movement can get really painful for certain shoulder injuries. And of course, one of the things we need to do is gradually restore that movement. So if you really struggle to do this, particularly in the earlier stages of like an acute injury, it can help to get the shoulder used to doing that movement through a passive motion. So obviously this is an active motion where I'm doing it with the musculature itself. However, if something else provides that motion, it's called a passive motion. So what I'm going to do is I'm going to take a broom here. I'm holding it in my right hand, and I'm going to place it in the palm of my left hand. Now, some people prefer to place it in the inside of the wrist there. That's also fine. I prefer to place it in the palm. And what I'm going to do is I'm going to try and turn this arm off as much as possible. So this is really just hanging there with the broom in the palm. And I'm going to provide the movement with this hand. So all I'm doing is now I'm passively bringing myself into shoulder abduction, sort of like I'm like a puppet. And I can get more range of motion. It's really common with this sort of injury that if you actively do this abduction, you might start to get the pain about here. However, if you do it passively, you can often go a lot further. Maybe you can go to about there before you start getting any pain, or maybe you might get no pain at all passively. So all you're going to do with this one is find the edge find the place where you kiss the edge of discomfort, starting to get a bit uncomfortable there, and come off it. Start to get a bit uncomfortable there and come off it. And over time, the point where you kiss the edge of discomfort will get higher and higher and higher up the range of motion. That is what we call it, a broom assisted passive shoulder abduction exercise. Give it a go. I hope it helps. See you next time.